Now, if you have somebody who is upset, many times we don't know. I mean, maybe sometimes we know if a patient's going to be upset, but a lot of times they might get upset about something and we weren't expecting it. We didn't know. Like a patient walks in, we ask them to put a mask on, and then they get upset about that, even though we've already told them, we have signs on the front door. They get upset and we're not expecting it. So if that's the case, my suggestion is to always try to move a patient to a private area or to an area where you can talk to them without disturbing the rest of the practice. So whether that means moving them into the operatory, depending on the scenario, moving them into a consultation room, taking them into the doctor's office, whatever it is, I want to try to remove the patient from an environment that's going to be uncomfortable for you. It's going to be uncomfortable for them, and it's going to be uncomfortable for other patients who are in earshot. Think about, and I'm sure you've all seen it, we've all been out where somebody was upset about some new policy that's going on in another business, or they're upset about having to wear their mask or whatever. People notice. It's like a train wreck. It's like an accident. They want to look. And we want to try to avoid that. We're already in an environment that's high stressed and we have all these new rules. And if I can take somebody who's upset about something, who's not in their right mind at the moment, they're frustrated, they're upset, they want to voice their opinion, and get them somewhere where we can talk and I can hear their opinion and I can give them our policies and we can have a real conversation. I want to do that versus having it explode in the reception area or somewhere where other patients can hear it. So whenever possible, and this is in general, if you've got somebody who comes in who's upset about their bill or they're upset about whatever, try to get them to go somewhere where we can talk, because we're trying to hear them. We don't want to be distracted, and we're trying to get them to calm down so we can have a real conversation. The next thing I'm going to say is, if needed, try to postpone or reschedule or pause the conversation if it's not going well. So if you're on the phone with a patient, let's say, and they're upset about a bill, a statement, a fee, and it's just going not in a great direction, ask them if you can, I don't know, go do some research and call them back in an hour, or call them back tomorrow, or can they go call their insurance company and call back? Like, take a pause. Sometimes when we're in heated conversations, it's better to walk away for a little bit, get some space, take a breath, calm down, and then continue the conversation. We don't know what's going on in our patients' lives. They don't know what's going on in our lives. Like, maybe we just had another patient get mad at us prior to that. Maybe they just had I don't know, almost had an accident on the road on the way in. Maybe they're having issues at home. Whatever the case may be, we might need to take a break, catch our breath, catch our thoughts, and then come back around and have the conversation. So don't feel so determined and so focused and so you've got to make sure the patient understands or fix this problem. Always right then and right there. If you need to, take a break, right? Step away. Maybe somebody else can give you a perspective, or maybe somebody will talk to the patient to help them explain. But it doesn't have to be settled right then and right there if it makes sense to pause it and come back later. And then lastly, and this is something I teach at Front Office Rocks all the time, is you don't have to be the dentist for everybody. So there are going to be some patients who you've given them enough notice, you've told them your policies, you've explained the policies, you've bent over backwards to help them understand why you guys are doing what you're doing. You've had good conversations with them, and they still come in and cause a scene or get upset. Maybe they're just not the right patient for your practice, right? I've seen a few examples. I was watching social media over the weekend where patients were coming in and swearing at your team members. They were cussing your dentist out, your hygienist out, whatever. I got to tell you what, that's not necessarily a patient that I want in my practice. Now, if they're not normally like that, and like I said, they have, this is an odd situation, maybe they have something going home, let them go, get some air, and then see if we can regroup, that they won't do that again. But in general, if somebody's coming into my practice and they're swearing at my team, they're irate, they're upset over wearing a mask or charging a fee or an insurance not paying something, and it's not reasonable, and we've done everything we can do to appease the patient and take care of the situation, there's got to be a line where you draw a line in the sand. And remember, you don't have to be the dentist for everybody. This is not saying that patient is bad. This is not saying that patient is not a good person. It just means they just don't want to follow your policies. They don't want to play by the rules in your practice, and that's completely okay. There's another dental office for them that's better suited. So just remember that we don't have to be the dentist for everybody. You have a lot of patients who love you. You have a lot of patients who trust you and who will play by your rules. You're going to have some that are a little more tense right now, a little more upset, and let's do what we can to work with them and help them. But then remember, at the end of the day, this is your dental office. This is your practice, and you need to do what's right for you and your team. So I can't stop the upset patients. I can't stop the situations we're in. We can't do anything about it except for try to do what's best for our team, for our patients, and for our practice. And if the case comes up, because there are a lot of tense people in the world right now, do your best to try to follow some of these to bring the tension down, come to an understanding with your patient, and then be there to take care of your patient. Because at the end of the day, you are their healthcare provider, and that's what we need to remember. So please share this. If you have other people that need to hear this, please comment if you have thoughts. And again, at Front Office Rocks, we're here to help you try to do the best for you and your patient and your practice. So I hope that was helpful, and let us know if we can help with anything else. Thank you guys, and have an amazing day.